Dr. Mark Pickering, thank you for sitting with us today.
You're very welcome, Matthew.
So, you are CEO at the Christian Medical Fellowship in the UK, and you are very active, and you describe yourself as a bridge builder and wanting to bring in more cooperation, particularly in the UK, but also, I would assume, also on an international scale. So, could you tell us a little bit more about the work that you're currently doing?
Absolutely, thank you. So the Christian Medical Fellowship, it's a UK organisation, the UK and Ireland. We've been going for nearly 75 years, so we support doctors, nurses, midwives and students of those disciplines. We've got about just under 5,000 members, and that's in all branches of medicine, nursing and midwifery. So we try to support them at any place where their faith interacts with their professional practice. So that's at different levels, but one area that we work in is public policy and ethics. And so the area of gender and sexuality is obviously something that's really hot in our culture. It's something that affects our members day to day. Lots of cultural pressures, lots of questions about clinical situations and conscience issues as well. And so I'm really pleased to be here meeting with some great people, hearing some great presentations and just getting my head around how we can advance the conversation in the UK around these issues.
Right, excellent. And so, you're here at the IFTCC Conference this year, and, you're meeting with activists and people who represent various disciplines. What does it feel like for you, and what are you getting from this conference this year?
Well, it's been great meeting some of the people that I've heard before. I've read some of their studies, and now to be able to talk to them a little bit more. Meeting, say, Joe Nicolosi, talking about reintegrative therapy, meeting Phil Sullins, other people like that, and that's been fantastic. Really, just to get my head around what the evidence is showing about the place of therapy in the LGBT space, and also the realm of change allowing therapy, and what is happening there. Really, what's the research showing at the moment? Because I think I've noticed in the UK, there's quite a polarized conversation often amongst Christians. It's the discussions about therapy haven't always been easy, and I think most of the discussions around amongst Christians in the UK is more about the pastoral support. It's about protecting the space for churches to be doing preaching, pastoring, prayer and parenting. But the area of therapy has been a bit more specialised. I think a lot of people in the UK have been a bit more wary about it. What does the evidence show? And also worrying that it may be difficult for people who are looking for pastoral support to then be shown, well, actually, you need to be changing, you need this therapy, you should be changing, why aren't you changing? Right. And that's obviously a difficult space for many people to be in. So I'm trying to think, well, how do we bridge some of those conversations? So I think one of the things that's really helped me is just seeing some of the evidence for the therapeutic approaches that's happening. There's some really great responsible approaches to that. I think people in the UK will often be concerned that as we look at some of the evidence, there might be sometimes a tendency to overplay that evidence, and I'm seeing a really responsible approach to that here. So it's been a great conversation talking with some of the people who are engaged in that research space, and I'm really pleased with the way that things seem to be moving forward internationally and amongst different organisations. So it's giving me a lot to think about and take away with me, and hopefully be talking to some of my friends and colleagues in different groups as well.
That feels hopeful. And with regards to the United Kingdom, we understand that there is a Memorandum of Understanding that seems to present a single view and bring many organizations under a single point of view. So how does that affect the work of Christian Medical Fellowship, and where do we go from here, do you feel?
Yeah, it's a great question, because the MOU on conversion therapy has been around for several years, and that really has had a very significant chilling effect. It's really shut down a lot of sensible conversations, and like many things in this area, it's put across as being responsible, safeguarding, making sure that people are not ill-treated, but actually it means that people just can't have sensible conversations about the potential for change and also what a client wants to bring out of that. So it talks about how you shouldn't be coming to a clinical conversation with any sort of understanding that one sexuality or gender identity is better than another, that you shouldn't be looking to change or suppress someone's sexuality. But what that means in practice is that if a Christian client, say, with same-sex attraction comes to a psychotherapist or a counsellor and says, well, look, I want to be able to live as an Orthodox Christian, I don't want to act on these feelings that I have, can you help me with that? It's very difficult for that therapist even to be client-led and to do what they're asking to. And the Memorandum of Understanding is really signed up to by pretty much all the professional counselling and psychotherapy bodies, some of the National Health Service bodies as well, and that does make it very difficult. There are also many other much more left-wing activist groups who really want to go much further, and when they talk about suppressing sexuality, they would go with prayer, so that if a same-sex attracted person goes to their pastor, says, would you pray for me? And the pastor says, of course I will. That, in their view, is conversion therapy. So it's very dangerous, I think, in the way that it's going. And the proposals for the laws in the UK, many people are just trying to be sensible and safeguard vulnerable people. But many other people are trying to bring in this really hardcore shutting down of conversations in a really quite frightening way, I think. And it's the real challenge is trying to pick apart the activism from the clinical picture and to find out what is a sensible way through. And that certainly is a challenge at the moment. But I think because of that, it's really important that the different Christian organisations are able to have better conversations together so that we can, trust each other, perhaps take a different view on some areas, but say, okay, you focus on that, we'll focus on this, and we can be agreed on some of these core issues.
That's great. Everyone can play their part that way. And if I had to ask you, what message would you like to leave IFTCC Learning trainees with today in terms of them wanting to improve the quality of help and understanding that they come into around this subject?
Well, I've been really impressed by the new learning site for IFTCC, the curriculum development, the working towards formulating IFTCC as a sort of regulatory body for therapists in this area. I'm really excited about that. It seems to be going very well, being gone about very responsibly, and I'm sure it's going to be a long, hard road to do that. But I have a lot of hope for the future direction, and it's just been great to be here with you this weekend, Matthew.
That's excellent. So thank you. God bless you.